Food allergy and anaphylaxis training. Anaphylaxis is a sudden, severe, potentially fatal systemic allergic reaction that can involve various areas of the body, such as the skin, respiratory tract, gastrointestinal tract, and the cardiovascular system. Onset may be sudden, generally within minutes to 2 hours after contact with the allergy-causing substance, but may occur up to 4 hours after contact. Allergic reactions may be mild to life-threatening. While anyone may experience anaphylaxis, individuals with asthma, eczema, or hay fever are at greater relative risk. Patients with asthma are those most at risk for life-threatening anaphylaxis events. Severe, even fatal reactions can occur in previously unidentified individuals. Senate Bill 27 was created in 2011, which requires the Board of Trustees of each school district to adopt and administer a policy for the care of students with diagnosed food allergy at risk for anaphylaxis. The policy must be based on guidelines developed by the State Commissioner of Health in consultation with the ad hoc committee. Signs and symptoms. Any severe symptoms after suspected or known ingestion, one or more of the following: shortness of breath, wheezing, repetitive coughing, pale, blue, faint, weak pulse, dizzy, confused, throat being tight, hoarse, trouble breathing or swallowing, the mouth has obstructive swelling about the tongue or lips skin may have many hives over the body, or a combination of symptoms from different body areas. For example, if your skin has hives, itchy rashes, or swelling, and you experience, or the student experiences gut, they're vomiting, diarrhea, or crampy pain. Mild symptoms: itchy mouth, a few hives around the mouth or face with a mild itch, mild nausea and discomfort. Management of anaphylaxis. 1. Determine if anaphylaxis has occurred. If suspected, treat as anaphylaxis. If anaphylaxis symptoms occur, get EpiPen, seconds count. Direct someone to activate the 911 or EMS system. Stay with the student or adult. Get or direct someone to get the EpiPen. Have others notify EMS, school nurse if you are not already there, parents, and school administrator immediately. Have the student sit down, calm and reassure. Avoid moving them. Calming reduces the distribution of the allergen in the body. Prepare to administer the EpiPen. If they are under 66 pounds, use EpiPen Junior or 0.15 milligrams. If they are over 66 pounds, use the full dose of 0.3 milligrams. Be sure that someone has called 911. To administer, pull off the safety cap. Firmly push against the outer thigh. You will feel or hear a sound. Hold injector in place for 5 to 10 seconds, then remove. Remember, call 911 if they have not been called already. The EpiPen can be injected through the clothing. If removing clothing is not possible or will significantly delay treatment, after receiving EpiPen, the victim or student or adult may feel his or her heart pounding. This is a normal reaction to the medication. If anaphylactic reaction is due to an insect sting, remove the stinger as soon as possible after administering the EpiPen. Apply an ice pack to the sting area. Remove the stinger quickly by scraping with a fingernail or plastic card. Do not push, pinch, or squeeze or further embed the stinger in the skin. This may cause more venom to be injected into the victim. Monitor breathing. Observe for signs of anaphylactic shock. If breathing stops, begin CPR immediately. Maintain the victim's body temperature. Cover the victim with a blanket if needed. Have someone make a copy of an emergency card for paramedics or print out the student's health history data. Give expended EpiPen to the paramedics. If symptoms continue or reoccur and the paramedics do not arrive, re-inject the victim with a new EpiPen 5 to 15 minutes after the initial injection. Continue to monitor the airway and the victim's breathing. Follow-up medical care should be obtained immediately in the emergency room. Document the incident. Date and time the EpiPen was administered, the victim's response, and additional important information. Take a moment here to review this video. Follow-up care. 1. Refer all anaphylaxis cases to the student's physician. 2. Recommend that the parents discuss with the physician about avoiding triggers and prescribing a new EpiPen. 3. Complete required documentation. In summary, caring for children with diagnosed food allergies at risk for anaphylaxis in the school setting requires a collaborative partnership with the students, parents, healthcare providers, and school staff. After this training, you're prepared to recognize symptoms of an allergic reaction in both diagnosed and undiagnosed students in order to respond to the student's emergency needs. If you're still not confident in your abilities, notify your supervisor that more training is required. These steps are extremely important and can lead to serious harm.